Hi, I'm Dr. Juyia from Elite Women's Care, where we provide gynecologic services. Today we're going to talk about endometriosis.
What is endometriosis?
Endometriosis, simply defined, is just the lining of the uterus out in the pelvis or elsewhere, and it can be a painful condition or sometimes not painful at all.
Are there different stages to endometriosis? How serious are they?
There are 4 stages of endometriosis. This condition is complicated, and so sometimes a person might have pain that is tremendous and their life is very affected by this, even though her stage is one of the lower stages. Alternatively, it's also possible to not even know a person has this condition until I go doing surgery for a tubal ligation and her whole pelvis is covered and she's actually stage 4. So there are different stages, and of course it can be considered serious at any stage, but the stages don't always correlate with what a person is feeling or the effects they're having from this condition.
What is the main cause of endometriosis?
Endometriosis is probably caused by a combination of inheritance and a person's risk for it that we don't completely understand. We actually even have several different theories to explain how this even occurs, and not just one of them can explain all the places that endometriosis can be in a body.
What can happen if endometriosis is left untreated?
Endometriosis is a condition that can be different for every person who has it, and it can be difficult to diagnose, or sometimes it can be relatively obvious. Leaving this condition untreated in people who it's not obvious in is often something that we don't even know about, or sometimes can be associated with unexplained fertility, and we find it when someone is trying to have a baby. Other times it's something that left untreated, the person is in terrible pain every single month, and it's something that we should not leave untreated because quality of life is important to preserve.
What are some treatment options for endometriosis?
The most common treatment option for endometriosis is going to be some form of hormonal contraception, which is something that a lot of people might be concerned about being on their entire reproductive life because it's also called birth control. But if you consider it more of a hormonal override and a treatment for a long-term condition, this also often becomes a more acceptable management.
What testing can be done for endometriosis?
As endometriosis finally gains recognition among providers and patients, there's attention drawn to the fact that it's difficult to diagnose, and there's generally considered 2 different ways to diagnose it. The most formal, most traditional method of diagnosis is surgical. Otherwise, there's also clinical diagnosis, which is generally response to treatment.